This is my humble prayer through the mighty name of our Lord Jesus Christ. Amen. Yeah. So we're going to learn together, right? Yeah. So what do we know about breast cancer? What is it that you hear every year? You know, this is Breast Cancer Awareness Month. This is Breast Cancer Awareness Month. What do you know about breast cancer? Thank you.
I'll tell you what I know. It's a disease which can attack your breast, even though you're a man or a woman, and they cut it off. That's what I know.
Wow. It is a disease that attacks your breast, man, woman, and they cut it off. Yes, for those that didn't hear. Yes?
Breast cancer is a type of cancer that develops in the breast tissue.
Thank you very much. It is a type of cancer developing in the breast tissue. Okay. You just tell me whatever you've heard. Is it what causes it? Is it some myth? Just tell me anything you've heard about breast cancer.
So what I know about breast cancer is that it's the name sounds hard, but ideally the cells in the chest, in the breast, the tissues in the breast are over multiplying in a dangerous way that it may not be safe for you. That's what I know about breast cancer.
Wow, thank you. There is another hand behind. Okay.
Okay, what I know is that breast cancer, it kills.
Yes, okay. Breast cancer kills.
I'm actually very happy to get this moment. There is a myth that has been going around. I don't know if it's true, and I looked forward to knowing the truth. I don't know. I have heard that breast cancer is a disease, or it's a cancer that is prevented by breastfeeding. Yes, sucking the breast.
By breastfeeding.
Yeah.
Okay, yes, we are going to see. Whatever. Okay. Okay. Uh-huh.
Good evening,
Yes,
church. Good evening, church.
Yes.
It's a pleasure to address such a concern. I can say breast cancer is a multiple myeloma which affects the breasts.
Okay.
Why I say multiple myeloma, this is basically the multiplication of cells within the breast. Yes.
Okay.
Misbehavior of the cells within the breasts.
Yes. Okay. Any other person? Yes, there is a hand here.
I'll define it through giving explanation of what I know.
Okay.
Breast cancer, these are cells that form in the breast and form tumors.
And film tumors.
Yeah.
All right. Thank you. Any other? Any other? Okay. So that is what is breast cancer. Have you heard of anything that causes breast cancer? Any of the things that cause breast cancer? Yes. Some answers. Yes. I'm saying hands. What are some of the things you've heard cause breast cancer?
I've heard that the little packets that are found in the bras that we wear, there are some packets that come with new bras.
Okay.
I'm told they cause breast cancer.
Okay. Yes.
I also heard that using steel wire to scrub saucepans, and then cooking oil.
Steel wire,
Yes.
like while scrubbing saucepans.
Yes.
Okay. Wow. Yes. What else have you heard causes breast cancer?
I have heard that breast cancer kills and it has stages.
And it has
Stages.
stages.
Yes.
Wow. That is super great. Then, anyone else? Yes.
Breast cancer, I have heard, is caused by toxic lotions and ointments and vaselines that are applied
To the breast.
To the breast, the bust region of the chest.
Okay. All right. Yes.
Surgeries?
Yes.
Surgeries.
Surgeries can cause breast cancer. Wow. Yes.
Smoking.
Smoking.
It
Wow.
lowers the levels of estrogen in the breast.
It increases the what?
It lowers the levels of estrogen.
Of?
Estrogen.
Okay. All right. Wow.
So what I know about breast cancer is that there are ladies, it's not common here, but outside, people who tend to tamper with the natural form of the breasts by creating it in a way that is suitable for his own euphoria, his own wellness. So in most cases, they tend to incorporate other things which are not supposed to be there.
Okay.
So I hear that causes cancer, but I'll prove today.
Okay. Wow.
At times also breast cancer is genetic, so that's all a chewala.
Okay. Wow. I'm so happy for all the things that. Any other answers that you're having about? Yes, sirs. Okay. Yes.
I've heard that it can be caused by prolonged bad sleeping posture.
Bad sleeping posture.
Yes.
Amazing. Yes. Age.
Yeah.
Wow.
As in women who are women who are in menopause are at a high risk of getting breast cancer.
Okay. Thank you. Yes.
Obesity.
Obesity.
People who eat and grow fat unnecessarily.
Wow. Okay, I had a hand here. I think let's take the last hand and then we talk about. Someone has mentioned
been mentioned.
it. Wow. Yeah, you know what makes me happier? Whether in adult classes we do not have wrong answers, yes? Yeah, but we're going to see some of the things. I'm sure some of the questions will be answered as we move on, and some of them we shall just answer later on after we are done with the presentation. But what makes me even happier is that at least 80% or 90%, or if not all of us have heard about breast cancer. Yeah, that is why we have all the views. That is why we are able to say something. It's because we know something already about what? About breast cancer. Now, breast cancer is like any other cancer, if you know about any other cancers, but this time round, it is coming from the what? The breast. Now, before we begin this presentation, you're seeing those objectives. You can leave them. We're just going to move. We have the structure of the breast, we have breast cancer and its statistics, we have the risk factors, the signs, how to screen, and I'll be teaching us how to examine ourselves, and also the treatment, and then if there are any questions. Now, before we even go to the next slide, I want to put a disclaimer. Okay, not really a disclaimer, but it could be a disclaimer. There are some of these pictures that may really look new to us, but we're going to take them for study purposes. Please take them as they are for what? For study purposes. Yes. Okay, we can now move to the next. Now, this, for study purposes, right? This is showing us the structure of a breast. This one, this side of a male breast, and then the other side is of a female breast. Now, what we see is whatever looks yellowish is tissue, fatty tissue. And then inside, what's different for the men is that they just have a nipple. They could have an areola. We call it an areola, that dark bit on the breast. After the nipple, then there is that dark, hyperpigmented something that is hypopigmented, I mean. So it is called an areola. And then inside it, we have ducts. Now, for the ladies, we have lobes. You can see lobes that are having very small, small things that we call lobules. That is where milk usually is. So through the ducts, it comes out of the nipple. That is normally what happens. Now, for the types of the breast cancers that we could be having, it depends on where they are originating. So if they are originating from the lobes, it could be a lobular carcinoma. Or it is a ductal carcinoma if it is originating from the cells that are lining those ducts. Now those could be the different types. I'm not going to go deep into the types because I'm very sure that is too much. So basically, that is basically what the anatomy is. Behind, you're seeing a rib. Those are the ribs, if you're seeing them from this end, from the cross-section end, but with the muscle in between. Then after it, we are seeing the whole breast as it's supposed to be. The other side, normally as we see it on top. Then this side, normally when we've dissected, and then we are seeing what is inside. So basically, that is how our breast is. Both male here, and then the female. For the males, they do not have the lobules because they don't need the milk to produce any milk, and they do not have the duct. So usually, most of our cancers really come from the lobes, and so we really have it more in female. So let's move to the next slide. So still, we are seeing the same thing. Now, when we go inside, could you please not laugh? When we go inside the lobe, so you're seeing this circle here, down here. Are the ducts, the small ducts that we've been seeing the other side. This time around, we've cut it to get a cross-section. And we are seeing just cells lining. So C is like the lumen where the milk will pass. And then we have B, and which are the lobules. And then we have A, which are the what? Are the ducts that will take our what? The milk. So from those cells, you're already seeing that it is just something like a cell, right? Yeah. So from those cells, we can have a cancer. Now, the question is, what is cancer? Let's move to the next slide. Now, cancer, our body is made up of cells. And we have processes in the body that are supposed to be regulating how our cells are formed each and every other day. Now, if we have some of the changes in our genes or anything, and these processes are not controlled, we are going to have them grow too much. And when they grow in a way that they are not controlled, we are going to form a what? A tumor. Now, tumors are just something like a mass, but it could be malignant or it could be benign. Malignant means that it can form a cancer that will spread to the rest of the body, and benign means it could be just localized, not really a cancer, just like any other tumor. So tumors can be benign or they can be malignant. We call it benign if it's not going to spread to the rest of the body, or if it is just localized. It is just uncontrolled cell growth, but it does not have the ability to spread. However, some malignancies, not basically this, some malignancies are able to change into, some benign tumors can change into malignant tumors after a period of time, but they are in other parts of the body. We're not going to speak about that right now. So you basically have to know that breast cancer, in cancer, we have uncontrolled growth of cells, but this time around, since it is breast cancer, they are where? In the breasts. Remember, I told you all the lobules and the ducts are all full of what? Are all full of cells. Now, if we have these cells growing uncontrolled, they are going to cause what? A tumor in the breast. And sometimes it is what? Malignant. So let's move to the next slide. These are the statistics. I wanted us to give these clear statistics because I want us to know how far we are with breast cancer. Why are we choosing to speak about breast cancer? Because it is affecting us so much. You may be there and you do not have breast cancer, but you need to know how it is affecting the rest of the world and how much it is doing that. It is impacting us. Now, according to studies that have been done by World Health Organization, breast cancer is the most common cancer among women worldwide. All women you're seeing, breast cancer is the most common cancer. So you bring any other cancer, it is just breast cancer at the top of the what? At the top of the list. It is claiming lives of hundreds of thousands of women every year and affecting all levels of modernization. Are we in Africa? Breast cancer is there. Are we in the US? breast cancer is there. Wherever you go, there is going to be what? Breast cancer. So it is very important that we get to know more about what? Breast cancer, and we learn about it. And also, coming back here to Uganda, among women, breast cancer is the second leading cancer death, cause of cancer death. So if you count any other cancers that are causing death, breast cancer comes second after cervical cancer. I'm sure cervical cancer that we've also heard about. So cervical cancer is still taking the lead, but breast cancer coming number what? Number 2. Yeah, let's move to the next slide. Yes, we continue to see that from still a study that was done, that was by 2012. Remember, our statistics is increasing as time goes on. 28 out of 100,000 new cases of breast cancer were always reported every year. Every year. Those are 28 out of 1,000. So you count 100,000 people, 28 are just new cases. And then, breast cancer does not affect only female. It affects everyone. All people, whether male or female, are born with some breast cells and tissues. So we have a possibility to develop what? Breast cancer. So are you a male, a female? This breast cancer can affect you. However, it is not really as equal. Now, if statistics are showing that if you count 100 people that are affected by breast cancer, 1 is a man, 99 are women. Yes? So it is affecting all of us. It's just that in the females, it is a little bit what? Higher. Because they're the ones having the more adipose tissue, the ones having the lobules, and some of these cells are coming from the lobules, they are coming from the duct, and yet we are the ones doing what? Having them. Yeah, so that is why we are having at least 1 in every 100. I mean, it looks so small until I usually say, it looks so small until you're the 1%. Yeah, it looks so small until you're the 1%. That is when you really know that it's a huge what? It's a huge thing. Let's move to the next. Yes, now, what are some of the risk factors? What causes breast cancer? It is very true that we get breast cancer. Sometimes, what we do know exactly is that there is always a damage in the DNA which you carry in your blood. Yes? There is always a damage to your DNA. But what we do not know is the exact cause. That so-and-so has breast cancer, this is what caused this to happen. Are you getting it? Because what I'm going to give you here are risk factors. There are so many people that are having these things, the risk factors, but they are not having what? Breast cancer. We're just saying that a risk factor increases the probability of you getting what? The disease. We're not going to say that it is the one causing the what? The disease. There is truly damage to the DNA. However, even us, maybe in the hospitals, we may not be able to tell that so-and-so is suffering from breast cancer. They definitely got it from this side. Or they definitely had this in their lives that caused it. We could say these are some of the risk factors that were in this person's life that could have caused what? Breast cancer. Now, these factors could be genetical. Genetical means inherited from parent to child, or they could be environmental. From our environment, there are some of the factors that we pick up, and then there are some that are lifestyle factors, the way we live our lives. Or in most cases, it is a combination of all of them. I usually compare the genetics to, usually, most of the diseases. I usually say that genetics is like, it's just like a gun and a bullet. Genetics puts the bullet in the gun, yes? But the environmental factors and our lifestyle triggers or fires the bullet. Are we getting it? So not everyone that has the genetics in their, a positive genetic history will have the disease. Most of the diseases, yes, we have the genetics, but sometimes what we do to our lives each and every day is what really causes the what? What makes this disease really come up. Even if it would have come maybe at a later age, our lifestyle may bring it at younger age. Are we getting it? Yes, probably genetics is responsible, but we need to take care of our lives too, and also take care of some of the factors around our environment. The next. So I've grouped these risk factors into non-modifiable. Non-modifiable are those we can't do anything about. Yes? And then the modifiable risk factors are the ones where we can do something about it. You know it, it increases the risk of this, I can do this about it. And that is where we get the prevention measures. Because the non-modifiable, for example, sex. Breast cancer occurs nearly 100 times more often in women than men. You cannot change the fact that you are a woman. It doesn't matter whether you identify yourself as male, you still are a female born that way. You cannot change it. And it is true that it occurs 100 times more in what? In females than in men. Then the age. 2 out of 3 women with invasive cancer are diagnosed after the age of 55. Yeah, like someone already mentioned. An older age is also a risk factor. Most of the times when we are having breast cancer in young women, in most cases, most of them are genetical. Most of them. But in most cases, if they're not genetical, or they could even be genetical at the age of 55, but that is when the breast cancers really begin to do what? To set in. Then the other is family history and genetic factors. If your mother, your sister, your father, your child has been diagnosed with breast or ovarian cancer, because causes of ovarian and breast are almost similar, so there is a higher risk that you're also going to have what? You're going to increase. And if your relative is diagnosed with breast cancer before the age of 50, the risk even increases the more. And if it is your first-degree relative, for example, a mother, it increases more than saying that, my great-grandmother had breast cancer. So someone who has their mother as having breast cancer has a higher risk compared to one who is saying, my great-grandparent had what? Breast cancer. So that is, the risk goes on doing what? Increasing. First-degree relative, then second-degree, like that. Then personal history, personal health history. If you have one breast is already affected by breast cancer, the chances are too high that the second one is also going to do what? Be affected by breast cancer. Then the menstrual and reproductive history. Early menstruation. Coming with your menses way too early. Because most of the times, it is too much exposure to estrogen. Estrogen, which comes at the moment so when you're having your menses come way too early, and your periods go too early. They go too late. Like, for example, beyond 55 and so on to 60s. That is when your menses are going. You're overly exposed to estrogen. And so chances are high that you're also going to get what? Breast cancer. The chances increase. It just increases the risks of doing what? Of getting breast cancer. Then having your first child at an older age. For the ladies that are here, your child coming in at an older age also increases your exposure to what? To estrogen. So it increases the risk of breast cancer. And of course, that comes with never having given birth at all as well, because it can't even compare to having your child at an older age. Then let's move to the next. We also have genetic changes. For example, there are some mutations. Now, there are a gene called BRCA. BR is simply breast, and CA is simply cancer. So, breast cancer gene 1 and breast cancer gene 2. We all have these genes. However, there are individuals that are born with these mutations already in their bodies because of the family history or inherited from up. So, of course, they have a higher risk of doing what? Of getting breast cancer in life. Then there is dense breast tissue. It is very likely that if the tissue is too big, you cannot really examine as much. So what you do, what you feel is not really, you may not feel anything when it is still very small. It even makes it harder for you to feel the mass. Then the next. Now the modifiable ones, the ones we can change or we can do something about it. One is late first pregnancy and not breastfeeding. You have the baby, you've given birth to the baby, but you're not breastfeeding them. Yes? We're buying them formulas nowadays. We are buying them anything because we are busy mothers. And not breastfeeding a child increases your exposure. So just breastfeed those children. You know, the milk is there for them. Sometimes I just don't get it why. But maybe mothers could be having their personal reasons. But it's very advisable and it's very good for the child. If there is milk and their mother is alive, it is better that they do it. They breastfeed. A late first pregnancy, we are talking about 35 years and above. In case you have a late first pregnancy, you're increasing your risk to getting what? To getting breast cancer. Next, drinking alcohol and using tobacco, like some of us already mentioned now. Tobacco has a number of things in it. Too many things in it, too many contents, the nicotine that could cause other things. And there are so many, about 600 something substances only in tobacco. And most of these are capable of damaging our genes, our DNA. And so when they damage the genes, chances are high that we are going to get what? We're going to get breast cancer. So it increases our risk. Just like I told you, a risk does not mean you're going to get. It just increases the possibility that you could get the what? The disease. Because there are so many people that are smoking out there and they're not having what? Breast cancer. So we're just saying it increases the risk. Then drinking alcohol. And then we have late adequate physical exercise. Some of us were here doing exercise. I told you, exercise is very, very, very good to the body. And that comes with unhealthy diet and obesity. I want to take all of them at once. When you have obesity, you have a lot of insulin resistance. You have a lot of things in the body. You have a lot of so you're taking in a lot of fats. You're increasing the risk to heart disease. You're increasing the risk to breast cancer. You're increasing the risk to almost everything. And eating unhealthy diet, this I'm talking about things with saturated fats, like red meats. Red meats include all the meats that you know out there. Okay, most of the meats that you continuously eat, maybe except fish and chicken. I know the rest to be red meat. I don't know about the red meats that you know, but red meats really have a lot of saturated fats. They're not really good to continuously eat them each and every time. Some of us can't really live without meat for a single day. It is not healthy at all. It is not healthy. So when we do not do exercise still, we are causing a lot of issues to ourselves because we are becoming obese. For us, obesity, we calculate it in kilograms per meter squared. Now, you get your kilograms, you measure yourself on a weighing scale, you get your kilograms. Then you divide it by your height in meters. When you go on most of the weighing scales, they are in centimeters. So when you get your height as 153, for example, you get 153 and divide it by 100. Those are centimeters to make it meters, in other words. So you get 1.53. So for example, if you're 60 kilograms, you get 60 divided by 1.53 squared. You square the downer one. And then you get your BMI, body mass index. Body mass index helps to tell us a lot. If you're within the normal range, you're well and good. But if you're becoming, it can also help you to regulate your weight. Do not be there and you do not know your weight. You do not know your height. Your blood pressure, they are very important. Blood group, they are very important for you to always know offhand that me, I'm this weight at this particular time, I am this height, my blood pressure is normal, I always go and they check me out. And it is also normal to know your blood group. Wherever you go, you know I'm blood group this. You get it, eh? They are very healthy things to know. And they are very important for your life. One day, they will surely save you. Radiations to the chest can also cause, because radiations are capable of damaging the DNA as well. Then we have exogenous hormone use. Now, exogenous hormone use, most especially if they are having supplemental estrogen in them. Supplemental estrogen can come from, for those that are before menopause, we are getting them from the contraceptions. And then, for those that are above, there are some women that want to do away with the effects of menopause, the hot flashes, the dryness. So what they do is to take the hormone therapy, replacement hormone therapy. So they are exposing themselves to more estrogen. Now such women, they will get, maybe they increase their risk, but their breast cancer, if it is to come, it comes at a very late age. You get it? After menopause, because they are introducing themselves to a lot of estrogen that is in the drugs that you're doing what? That you're taking each and every day to decrease the effects of menopause. Then the next, so what do we see? Whenever we have, what can we see in order to say that, this could be what? This could be breast cancer. There could be a hard lump in the breast or sometimes in the armpit. It can occur on one side only, or it can occur on both. So typically, it is painless. Yes? It is painless. Then the next, you have a change in the size or shape of the breast. So you have the veins and the size or shape of the breast. And sometimes you have skin color changes. There are sometimes of carcinomas. Carcinoma is the same as a cancer. Eh? There are sometimes when a cancer of the breast looks like an orange. Not that your breast looks like an orange in color, but just like the texture of an orange with a lot of, what should I call them, dimplings. Eh? So the breast is just having such a kind of a texture. It is very typical. Eh? Yeah, though it may not be easily seen, but it is very typical. It can have, that is what we are calling an orange peel-like appearance. Eh? The peel on top. How it looks like, that's exactly how the breast does what? Looks like. And then you could have changes in the nipple going inwards. Yeah, I think, or some discharges, most especially bloody. We can go to the next slide where you're going to see those changes. Eh? So you have swelling under the arm. You can have breast ulcerations. Down there, you're having more like a dimpling, a breast nipple that is already dimpled. It is retracted inwards. Eh? Same to this one. Then the other one up is normal. The rest are some of the things that we could see and say that possibly. But whenever you see them, don't get scared. Sometimes the masses we could be having in our breast could be due to other tumors that are not really what? Really cancers. So it is better that the moment you feel it, you immediately go to a healthcare provider and then they test it and they see what exactly is going on. Sometimes, actually most of the cases, it is really benign. It is not really, it won't multiply. It is just a tumor. So don't get scared whenever you see it, that you know what, I'm dying in the following few minutes. Some of the people told me breast cancer kills. Yeah, like we saw, it does kill, but when we get it, we go for medical and we seek medical attention. It may not be what? Breast cancer. Let's move. So now, next, we are going to the screening methods, or how we could begin rolling out. I think the whole Breast Cancer Awareness Month is all about, getting the public to know about breast cancer, how it exists, and how to do the self-examination, and when to seek for care, for what? For health advice from a healthcare provider. Now, breast cancer screening, breast self-exam. It is good to always examine yourself every month. If you're in your periods, at least 7 days after your periods, you examine yourself. Because you know that there is that breast engorgement and pain that could usually come with the periods. But 7 days later, it is already what? It is already gone. So it is good that you always examine what? Yourself. And If you're not having your periods, for example, you're pregnant, you could just get a specific day in a month and you're like, today or this day is my day. I always examine myself to see if there are any changes in my breasts. It is very, very important. Let's move to the next. Now, this is how we're going to do the self-exam, the breast self-exam. One, you're going to stand in front of a mirror because no one else is going to be looking at you. Mirrors are important to a lady. I'm very sure most of us do have them. They are really important. And it's good that you get a mirror where you can really fit, where you can see well what is going on. You stand in front of a mirror and then you closely examine your breasts. Now you're going to put your hand straight and your arms on your hips. Are you seeing this hand around your hip? And then you're going to use the other hand. If you're going to examine the left breast, you're going to put the left hand here, and then you're going to use the right hand to examine. You're going to check if there are any shapes or changes in the size of the breast. Is it unnecessarily growing too big that I do not know? That in the past few days it has now changed size, it has increased. What could be happening? Check out for any skin changes. Are they rashes? Even if it's just a rash, you could go and check out what is happening. So that you're at least in the know. Any redness, any dimpling, orange peeling, like I've already told you because we've already seen some of the signs. Then check out for the nipples. So we've seen you check for the shape. You're going to check for the skin, its appearance. You're going to check for the nipples, and you're going to check if you're seeing any sizes. Are you noticing any increase in size of the veins compared to the other breasts? So everything you see, you're going to be comparing it with the other breast. Then, after you've examined, you raise your hands and do the same changes, and you look out for the same things. The first is when your hand is in the chest, in the waist, around your hips, and you're examining. The next, you're going to raise up your hand and then do the same things or check out for the same things. So while you're still in the mirror, you're still going to look out for any discharges that you could see. Yes? Any discharges. Are you seeing any discharge coming out? If you're breastfeeding, of course, milk could be coming out. But any other discharge that is not milk, what is its color? In case you have any, you go and seek medical attention. Then what is next? Now this is the slide. So that the fourth step, you're going to lie on the ground. Now we are checking for the masses. So you lie on the ground or on your bed, and then you're going to examine your breasts. You're going to use the palm. Please don't use the tips. Some of us just press like this around. You use the whole palm. We examine using the palm. You could use these 3 fingers. Move them around the breast, the whole of it. I told you this hand checks this side. This one checks this side. Are you getting it? So you're going to move the pad of your fingers around as you examine and see if there are any masses that you could feel. Then later on, you're going to stand up or sit. Please examine everywhere. Rotate everywhere around the breast, or press on that nipple as well, and see if you're feeling any abnormal masses. You getting it? Then you're going to sit or stand, cover the entire breast with your hand. Yes? And still feel for any masses that could be there with the whole hand. You're going to do all the 5 steps on both breasts. It is very, very, very important because you could notice something after some time. If you're not doing regular breast examinations, it may be hard to notice. But if you keep doing them every month, you're going to definitely notice some of the changes. Let's move to the next slide. Now, a clinical breast exam. This is the same as a breast exam. It is not any different from a self-exam, but rather this one, the only difference is that it is done by a health provider. Now, the health providers, they have seen a number of things. they could notice something that you may not have noticed, that you may have taken as normal. It is advised that you at least have one clinical breast exam once every year. You go to your doctor and they check you just once a year, because you may skip out something that could really be very important according to a what? According to a doctor. But otherwise, they may not be any different with the two. Yes? Then the next. So the third screening method, we're going to get a mammogram. Mammogram is an x-ray of the breast. So it is recommended that all women 40 years and older, because we saw that the risk increases as you go up, all women that are 40 years and above get this x-ray at least once in a year or 2 years. You just get it and see if there are any changes. The mammogram can pick some of the changes that have already come in that an eye cannot see, or that our hands cannot do what? Feel. So it can easily pick up something. And the earlier these things are picked, or the tumor is picked, the better the prognosis, or the better the outcomes will be at the end. Let's look at the next. The next that we could do, so if we've done a mammogram or the x-ray of the breast, and we find out that there are any cancerous lesions, we found out there is any affected area, for us as healthcare providers, we go ahead and do a breast biopsy. A biopsy is just like taking off a tissue and taking it to examine it under a what? A microscope. After examining it, we see which kind of cells are multiplying at this point in time, where is the cancer coming from. It gives us a bigger picture of the kind of cancer you're having, because even the breast cancer has so many different types. So it gives us a better way of how to manage. So there are many things that we could do. Fine needle, you could just use a needle, they get a needle, a biopsy needle. It is very small. Of course, they're not doing it while you're feeling, because pain is real. But this time round, you're given some analgesia or some anesthesia, and then they go in with a needle and they remove some tissue. For the women, you know how painful a breast can be. So this can't be done when you're feeling, of course. So we're basically picking up some of the tissue and we are taking it to examine it under a microscope and see exactly what is happening in the cells. Then the next. Now, someone talked about stages. I did not go in the other big stages of stage 1, stage 2, 3, and 4. I just brought up this on the surface for us to just see, because we are going to try managing it later on. So early stage, the cancer is just in the breast tissue. Then we have the locally advanced. It has exceeded now only the breast tissue. It has gone to the underlying, to the chest wall. Like we saw, that the tissue is just on the what? On the ribs. So it has already now moved to the chest wall. Then advanced, it has already moved to any other part of the body. It has now metastasized to other places of the body. So basically, those are the stages that we could know. The other ones are a little bit too much. You're going to 1 into 2. They're a little bit too much. These are the stages that that is how I could actually simplify them to us. Sometimes it's just on the breast tissue. Sometimes it has now gone to the wall. In the advanced, it has moved off the breast and it has gone to affect other parts of the body. Next. Now, thereafter, we're going to some of the treatment. What do we do after you've gotten the breast cancer? There are a number of options that we could do depending on the stage. Remember, I've told you we have the early, then the local, advanced, and then the advanced, or the one that has gone to other parts of the body. Treatments may include going for surgery. Someone told me they cut you when you have breast cancer. There is radiotherapy. We're just using some kind of method where we use radiations to kill the cancer cells. Then we have chemotherapy. Chemotherapy, we give you drugs to take. whether intravenous or inside the blood vessel using a cannula or just taking orally. We could have some hormonal and targeted therapies. Just move to the next and we move through the treatment quickly. Now for surgery, we have sometimes we just excise and we remove the tumor that is there only. Or sometimes we could go around the whole and we remove the whole what? The whole breast. Now that depends on the stage of the cancer. If it is still just localized, we could remove just the tumor that is inside. And then after that, we could do radiation. It may not go alone to make sure that we prevent any other recurrences. That is why it is good to keep checking ourselves, because the earlier it is detected, the better the treatment. If it is earlier, we could just remove the tumor, we do radiations, or we kill these cancer cells using radiations to make sure there are no recurrences. But now if it has already gone to late stage, life becomes what? Life becomes hard. Next. And radiations, we could radiotherapy, or using radiations, we could use them just before the surgery to decrease the tumor in size, or we could do it after. These are some of the treatment options that we have out there. So either way, we may not use it alone. We may do these radiations before even chemotherapy, before we begin giving you the drugs, or after, or during the treatment, whichever is easier, but we may have to combine all of them. Then next. Chemotherapy, as I've told you, they're just anti-cancer drugs that we are going to take. And sometimes, most especially in the advanced stages, the cancer has already spread to the rest of the body, and honestly, there is nothing much we could do. What we can do is to help increase life and alleviate the symptoms. We are saying some of the symptoms we are having, we are now wanting to alleviate them or to decrease some of them. The pain, the what, we may want to decrease them. But when it has already metastasized to other parts, it is really hard. So what we use in these cases, we just use chemotherapy. Because even if we remove the breast, these cancer cells have already spread to the rest of the body. They are already damaging organs, and there is nothing we can do about it. I mean, we can't keep on removing each and every other organ, because how are we going to live? So the best thing is to give you chemotherapy, which drugs are going to help us to elevate the what? The symptoms, and also increase your lifetime a little, by a little few years, by giving us a little more years. But usually, sometimes we may give you the chemotherapy or the drugs after, even if your cancer hasn't really grown. So we've just removed the what? We remove the tumor and then we give you chemotherapy after. Or we can give you chemotherapy, decrease the size of the tumor, and then we do the what? The surgery. But if we've already reached advanced stages, it is chemotherapy alone, just to help you increase life and elevate symptoms. Let's move to the next. Hormonal therapy, there are just some other kinds of medicines that we are using. We're just using some other medicines that are inhibiting estrogen and progesterone. That is after doing a biopsy. After doing a biopsy, there are certain types of cancers of the breast. So depending on the cancer type, so if it is due to the exposure of estrogen, now we give you some of the hormonal therapies, some of the drugs that will increase, that will decrease, that will inhibit the hormone called estrogen. Someone already mentioned it. Then next. Then we have targeted therapies, still the same thing. It is existing for the treatment of advanced breast cancer, and it should be used in conjunction with other therapies or as a maintenance of what? Of chemotherapy. I think those were the slides. I'm not sure there is any other thing. Any other? Yes, some of the myths that we hear about breast cancer that do not cause breast cancer. I put some of the myths. One, breast cancer is not contagious. It is not going to move from her to the one next to them. Just because you're next to them, it doesn't mean you're going to get what? Breast cancer. It is not flu, that it will come from one person to another. It is not what? It is not contagious. The second one, it is not caused by wearing bras. At least there are no perfect studies that have shown that putting on bras is causing what? Is causing breast cancer. The third myth, implants, as myths often suggest, there are no studies that have been done to show that implants, I mean breast implants, are causing, because sometimes we can, when we remove the breast or we've removed some mass in the breast, sometimes some people go ahead and put in implants, to make sure that there is balance or what, or for beauty, they put in implants. So there is no association of the implants and breast cancer. Studies haven't shown that. Then the fourth one, using deodorants and antiperspirants. For those that use the deodorants, there are no studies showing that deodorants are causing what? Are causing cancer. Some of us keep on fearing the deodorants each and every day. You can go ahead and use them. They really don't cause the breast cancer. Then microwaves or cell phones. There are some people that think so, that they could do what? They could cause cancers. That's just a myth. There are no studies to show or to prove that it can cause breast cancer. Now, it has been a lot of biology and a lot of hearing. Yeah, about breast cancer. But all in all, some of the signs to show, some of the things you should be looking out for in your breast. That is very important for you to do what? You could forget every other thing, just some of the signs. And the modifiable risk factors, because I told you that's where the prevention does what? Comes from. Eat healthy, do regular exercises. If you can give birth, please, and breastfeed the children at an early age, and also breastfeed these children. And also, if you're smoking or taking alcohol, it may not be as much since we are here, but I'm still going to talk about it because I'm not sure where we all pass. But if you're doing it, and by the way, smoking tobacco does not only apply to the people smoking tobacco, it applies to you who is inhaling the smoke as well. So if you keep around the places where people are smoking smoking tobacco, you've got to do what? To avoid such places, because that smoke is affecting you too. Not only the breast cancer, but also many other cancers. This is the same smoke they're taking in. It is the same smoke you're taking in, though it may not be at a high risk like one who is directly smoking it, but it is also giving you some percentage. You're also taking in the smoke. All the carcinogens that are in this tobacco. Carcinogens are some of the substances that cause cancers. We call them carcinogens. So you got to be very careful with the people that are smoking around you, because you don't want to keep inhaling that tobacco. If you're taking some alcohol, you could also stop. Yeah, some alcohol. It is wine, it is what, depending on whatever amount of alcohol. Of course, studies are showing that, 2 bottles are okay for men, 1 bottle is okay for female. But us as Christians, we're not supposed to be taking any amount of alcohol. It is not good for our bodies. Yeah. So any other modifiable risk factors? I've already told you, eat healthy, do regular exercise. These things are preventing us from a lot of things. Lots of things. Not just breast cancer. But eating healthy and living this lifestyle is really helping us a lot. Our Lord has given us the kind of lifestyle he wants us to live. And he has given us all the instructions that we ought to follow as if we want a healthy or a better life. Moreover, we even read a verse here. If you do this, this, and this, I'll also keep the diseases away from what? From among you. So, it is also very good that we keep the preventive measures in check. And it is very good that we keep doing the regular breast examinations, the men too. Yes? The men too. At least encourage your wife to always do them. Because remember, when it affects her, it is going to affect your children, it is affecting you, it is affecting the whole family, the well-being of the whole family. So as the men, also keep encouraging your wives to keep doing this as you also do it. Are you getting it? Yeah. So I think that could be the end. And at this time, I want to take up any questions. In case your questions have not been answered here and there, we can now go back and see if there are any questions that we are taking. Yes, I'm seeing a number of questions. Wow. Some pen. Someone to help me with a pen.
Yes, we thank you so much, Doctor. I think by now I know more about that. But I have two questions. You say that uncontrolled sales. Then how can I control? How is it controlled?
How
you
is
say
it
uncontrolled sales.
Wow.
So how is it controlled so that cannot bring cancer? Then the second question, I had someone saying that normally the breasts are not equal, normally. So I may stand in my mirror and my breast not equal to this one. So can you please teach me more about how I can differentiate the other, that this one is bigger than this one when there are some which are normal?
I wanted to inquire, does the first stage show any signs? Is it possible that you can have breast cancer unknowingly, and then you go for checkup, they tell you it is on the advanced, the last stage? Is it possible that you can have it for a very long time? And also, is it possible that you can actually have lumps? You can have lumps and still not have cancer? The masses in the breasts.
Yes.
My question is around family planning. Does family planning also cause breast cancer? For example, pills?
Yes.
My question comes on who is much affected, the passive or the active?
With
Passive,
tobacco.
yes, passive smoker and active smoker, because I find it a little tricky that the active is even having a filter, while the passive doesn't even have anything to protect.
Yes. Any other questions? We could first answer these ones. How is cell growth controlled now? I would wish to say that that is too much biology. There is a very big process of cell division in the body that has to go on. And there are very many checkers at every stage. We have a number of stages that we go through. How simply can I explain this? I don't know how to explain it best, but we could say that, for example, if you're farming and you're growing a crop, at every stage you're checking out for something, that now it has come out of the soil, what is happening? That now it has come out, it has now reached here, what is happening? It is now time to weed it, it is now time to do it. Now, when we are having the process of cell division, we are having a number of processes that are going on. And amongst them, we have the genes. Our genes are busy controlling the growth of these what? Of these, the way these cells are dividing. So they are controlling in case there are too many. Some of the cells are being killed. Some of the others are continuing to the next stage. Because killing of the cells, we call it normally apoptosis. Something, we could just say killing of the cells. So some of the cells are being removed. Some of the cells are not being allowed to continue. Some of the cells that are missing some genes, some are missing or having any defect, they are not allowed to continue. They are killed immediately. Now, when there is a defect in the genes that are controlling these cells from growing too much, now cells begin growing uncontrolled. It doesn't matter whether it is a cancerous cell growing to the up. It doesn't matter whether it is missing anything. It just continues growing because there is no checker in the middle there. So we are having cells uncontrollably doing what? Growing. That is how best or simply I can put it. I don't know whether you've got me. The unequal breasts. Yeah, it is very true. I think, I don't know if there are ladies that have equal breasts, but most times, I don't know because I have not seen all of them, definitely, but most of the breasts are not equal. They are not equal. So, but as a woman, you notice the difference in the breasts. Yeah, and if there is too much difference, you can easily tell that, now, this breast is now increasing in size. This is not normal difference. Yes? Because, these breasts on your chest every day, and you keep looking at them. That is why it is very important, again, to do a self-breast exam. Because the more you do it, it helps you. You keep in the check of what is on your chest, and also you keep noticing in case of any slight change. You can easily notice it because you know exactly what is there. Because sometimes it's unequal. We keep comparing it to the other. But yes, they are not equal, but you will always notice if there is a difference that is bringing a problem, that is problematic, yes. Possible that you may not know, yes. Mothers come, women come actually at a very advanced stage. That is why we are carrying out the breast awareness. We are having the breast awareness month. That is why we are here talking about breast cancer. Because we are not examining ourselves, that even the slightest of a simple lump that is inside, of a mass that is inside, we may not pick it when it is still early. That is why we are having all this awareness, so that we can at least arrest breast cancer at a very what? At a very, at a small, well, should I call it at a small age, or when it is still too early. Yeah, that is why we're having this. But otherwise, if you do not continue doing it, it is very possible that, yes, you will notice when you already have a lump under. You will notice when things are already, and the whole cancer has started acting. It has already spread. Now other parts have already started shutting down. That is when you're coming to the hospital because you're having already complications of the what? Of the cancer. So in case of anything you don't understand about your breast, please go to a healthcare provider and they help you out. It is far better. And then masses without cancer. Yes, most of the masses are actually not cancerous. So when you touch your breast and you feel a lump, I told you there is no need for you to be scared about anything. Just go to the hospital and we prove out this mass and we see what is growing inside there and we manage you accordingly. But yes, sometimes a breast may be growing bigger and we're just having mastitis, which is simply inflammation. We could be having other things. Some of the mothers even get pain while breastfeeding, and the breasts begin bringing some, because of course I'm not saying it is not cancer, but I'm also saying we don't know whether it is cancer or not. And some of the tumors, yes, are not malignant or they are not cancers. They could be benign, it's just a tumor, and it is all about you. When you feel it, just go to the hospital and we check it out. We examine it under a microscope. We get a tissue of the tumor, we put it under a microscope and we see the kind of cells that are growing in here so that we determine. The pathologists usually know whether it is the cells, how they would look like. Then family planning, e.g. Pills. Now pills, remember I told you when we expose ourselves to too much estrogen, we are increasing the risk of breast cancer. It has shown that contraceptive pills, or they have, most especially the ones that are containing estrogen, they have a 7% increased risk in getting breast cancer. So yes, they increase the risk, but I did not say they really are the cause of what? Of breast cancer. Remember I told you the risk factors? I told you it is just a possible, increasing the probability of you getting it. But there are so many people that have taken the pills. So based on its advantage, or it outweighs controlling, family planning outweighs the risk of getting breast cancer. And that is why it is out and being used for family planning, because its advantages in controlling, in doing family planning outweigh the risks down of getting breast cancer. But yes, it does increase the risk. Studies have shown that it does increase the risk. Then passive versus active smoker. Who is most affected? Yeah, we usually say the passive is most affected because we want you to stay away from the person, from the people that are smoking. So you will get affected because you're not smoking and you're getting the same effects with someone who is smoking. But again, the one who is smoking, of course, exposes themselves to more than one who is just passive on the side. So yeah, the one who is smoking gets more risks, but you who is not smoking, I mean, you don't take tobacco, you're not smoking, but you're getting these effects. It really does hurt. So staying away from an area where people are smoking is a little bit better. But I personally believe, from the question, active smokers are really more affected. But passively, it wouldn't be good for us. Yeah. Do we have any other questions? Yes, I'm seeing a question there. I hope I'm answering the questions. I'm trying. Yes?
Thank you so much, Doctor. So on a psychological level, you talked about how breast cancer is hereditary. Say the mother had it, chances are the daughter can also have it.
Mm-hmm.
So is it advisable for a parent, the mother, to break it to their child that there could be a chance that they might as well have it, maybe when they grow up? At what stage should a child know?
At what stage? Well, I think when the child is old enough to know. Okay. I am not sure about that, but in most cases, remember, breast cancer is coming at an advanced age. Now, it is going to get your mom probably at an age of like 55. At that time, I'm sure the children, in most cases, they're old enough. If they're old enough to understand that now their mother is having breast cancer. Because in most cases, I'm very sure if our parents are having any chronic illnesses, be it hypertension, diabetes, we always know. We know that my mother has hypertension. Yes? You know that my mother has diabetes. When you're old enough to know, you always know that your parents, now my parent is having a stroke. Now my parent is having this. So it is also good to keep knowing our family history. That my mother's side, the auntie suffers from sickle cells. These are things we always keep knowing. We always know them. Of course, for a child that is below, I think 12 years, we would rarely ask them about, because we always ask the guardian or the parent that, in your family, do you have this, do you have that, so that we see the risks of the child. But I think when they're old enough to understand disease, they can know, and they will know. You don't even have to tell them. They'll just, I don't know. I don't think it's really telling them that, now I have pressure, now I have this, and they will always know. If you can educate them about breast cancer and the risks that are coming to them, then you're giving them a very great service. If you can educate them, it is very great to them to know that there is a risk they could get breast cancer, but also assure them that it does not mean they are going to get it. Yes? It is just a probability that they could get. So that they are very careful of the environmental factors and the lifestyle they're doing they are living. Yeah, I do. About the age, really, I'm not sure. Yeah. So are there any questions? Before I leave here, I'm not seeing any questions. I want to read us a verse. I want to read us a verse from John chapter 14 and verses 27. John 14:27. John 14:27 says, "Peace I leave with you. My peace I give unto you. Not as the world giveth, give I unto you. let not your heart be troubled, neither let it be afraid. I want to repeat this verse. John chapter 14, verse 27. It says, peace I leave with you. My peace I give unto you. Not as the world giveth, give I unto you. Let not your heart be troubled, neither let it be afraid. Neither let it be afraid. All in all, if you're having the disease, or if you're looking at the risks and you think you're having more risks, I want to leave this verse with you. Christ is telling us that he is giving us peace, not as the world gives. Remember, Christ promised not to take us out of this world, but rather to protect us as we are living with the beasts that are around us, I would say, or every other things that are going around us. So he promises that he will take care of us. And so, the peace that he's going to give us is not peace that, I will not get disease, that, I will not become poor, that, I will not do this, that, me, I will always be rich, me, I will always be in good health, me, I will always be in this. That is not the kind of peace that Christ is giving unto us, because he says he's not giving us peace as the world does what? As the world is giving us. But he's promising us that even when you're having that disease, whether it's not curable or it's curable, whether it is what? Whether you're poor, he is saying, I will give you peace. There is that inner peace you will always have if it is directly from Christ. You're having a number of troubles around you, but you find yourself at what? At peace. It's not like Christ promising us peace doesn't mean it is going to take out all of the troubles in our lives, but it simply means that with all the troubles in our lives, he is still promising us the what? That calmness and the peace of mind. And so I want to leave us with this verse, that as we begin this week, let us always remember that for all the troubles that are around us, is it sickness and we think it can't cure? Let us always trust who? Trust Christ. If you feel like your heart is too troubled, that it cannot rest, there is also this song that is 316 in our hymn books, in the SDA hymn. It says, live out thy life within me, O Jesus, King of kings. Be thou thyself the answer to all my questionings. Be thou thyself the answer to all my questionings. If you feel like you have those questions that just can't be answered, I mean, you're asking yourself, you're having maybe breast cancer or something else, and you're asking yourself, why me? God, why did you choose me? There are so many people out there smoking. There are so many people taking alcohol. There are so many people who are possibly having all the modifiable risk factors with them, but they're just not having it. And then there is you who has been trying to live out your life in a good way and with good lifestyle, but you're still having the disease, or you're still having any other problem. And this song is saying, be thou thyself the answer to all my questionings. You can always ask him to give you the answers. And you can always pray that he gives you peace that is coming from him himself. Because the world cannot give us the peace we do what we need. May God bless you all. I think we're going to humble ourselves and we pray as we finish this session. Let us pray. Dear God, we thank you very much for teaching us about breast cancer. We are so grateful for all the lessons we've learned since morning up to this time. We're so grateful that you helped us leave our comfort zones, our homes, to come here and worship you today. For all the things that we've learned, we kindly request you that let the same spirit that has inspired us to learn also inspire us to do. For all the things that we've learned about our health, we're very sure that, dear God, you do not want us to live in a bad health. You really want the best for us. And so we kindly request you that may you give us the energy to put all the prevention measures into action, mighty Lord. We do not have the energy to, but you know that we know that you, our Christ, really does have all the energy to help us put all these things into action. As we leave out to go for a new week, we kindly request you that may you start this week with us. May you hold us by the hand, dear God, and lead us through the week. This is my humble prayer this evening through the mighty name of our Lord Jesus Christ.